How does raloxifene treat osteoporosis differently from estrogen therapy? Imagine fighting osteoporosis with two different tools that both aim to strengthen bones but work in very distinct ways. Raloxifene and estrogen therapy are both used to help prevent bone loss, but they do so through different mechanisms and with different safety profiles. Raloxifene is a type of medication called a selective estrogen receptor modulator, or SERM. This means it specifically targets estrogen receptors in certain tissues like bone, acting like estrogen to promote bone strength. But it also blocks estrogen effects in other tissues, such as the breast and uterus, reducing the risk of cancers in these areas. Estrogen therapy, on the other hand, provides systemic estrogen that affects the entire body. It binds to estrogen receptors everywhere, including bones, breasts, and the lining of the uterus, which can lead to broader effects. When it comes to how well they improve bone density, estrogen therapy generally has a stronger impact. It tends to increase bone mineral density more significantly, especially in the spine and overall body. Raloxifene also boosts bone density and lowers markers of bone turnover, which means it helps slow down bone loss. However, its effects on increasing bone density are usually less pronounced than those of estrogen therapy. Both medications help reduce fracture risk by making bones stronger, but estrogen tends to be more potent in this regard. Safety is another key difference. Estrogen therapy can stimulate breast and uterine tissue, which raises concerns about increased risks of breast cancer and endometrial hyperplasia, especially if used long-term without added progestins for women with a uterus. It may also increase the risk of blood clots and cardiovascular issues. Raloxifene does not stimulate the breast or uterine tissue, so it has a lower risk of these cancers. While both drugs can increase the chance of blood clots, raloxifene's side effect profile is generally considered more favorable for long-term use, especially for women worried about cancer risks. Estrogen therapy also helps with menopausal symptoms like hot flashes, which raloxifene does not address. Both medications can positively influence cholesterol levels, lowering LDL or bad cholesterol, but raloxifene does not significantly affect blood pressure or blood sugar. In practical terms, raloxifene offers a targeted way to protect bones without the broader systemic effects of estrogen. It is especially useful for women who need osteoporosis treatment but want to avoid the risks linked to estrogen therapy. Still, choosing the right treatment depends on individual health factors, including fracture risk, cancer history, and personal preferences. Always consult a healthcare professional to find the safest and most effective approach for managing osteoporosis.